hello everyone from watching us from Instagram. My name is Christopher Moreira, and I'm a program coordinator for the National Hispanic Medical Association, responsible for programs related to the CDC Let's Stop HIV Together campaign. But some of you may also know it as la campaña de Detengamos Juntos el VIH con el CDC. So a little bit about the campaign. For our viewers, the campaign aims to increase access to HIV testing by providing free kits for testing and educational materials, working towards ending the HIV epidemic. So during our discussion, I will have our guests discuss ways to get these free test kits, but also keep a lookout for resources from the campaign after our event on the IG story. And as you all may know, today is National HIV Testing Day, and we recognize the importance of knowing your status, but also taking preventive measures to keeping our communities well informed, and on the importance of sexual health education and HIV testing. Our awareness theme for this year is Level Up Your Self-Love, Check Your HIV Status. And I am joined today by two amazing community ambassadors of the CDC's campaign, José Aguilar and Sullivan. Thank you both for making some time for our audience. Now, before we get to testing, first I want to talk about the destigmatizing conversation, destigmatizing HIV, and address the anxiety that patients might feel when coming in to wherever they find most available the testing services. Before doing that, I just want to give the floor to you all to talk a little bit about yourself and also what National HIV Testing Day means to you.
Sure, I'll go first. Hi, everyone. Thanks for joining us today. My name is Sullivan. I am a certified physician assistant living and working in Los Angeles, California. I work in an LGBTQ plus focused primary care practice, and so a lot of what we do involves both treatment and prevention of HIV. And I'm also active on social media, and like Christopher said, I'm a community ambassador, just like Jose, for the CDC's Let's Stop HIV Together campaign.
Thank you so much. Happy to be here with you all. My name is José Aguilar. I am a director of case management and the insurance subsidy program manager at Pineapple Healthcare. Also loving what we're doing in the community because we're a primary care practice focusing on minorities in the LGBTQ plus community, in the Hispanic community, and women as well. We're doing an amazing work in Central Florida. We're in Orlando, Florida, and also the founder and executive director of Aguilar Salud, a Hispanic nonprofit organization serving everybody that speaks Spanish. So basically, Hispanics are our main focus. And as a CDC community ambassador is also my role to ensure that we are addressing the HIV epidemic with more information in Spanish. So we're being more culturally competent. I'm a Venezuelan immigrant living with HIV, just as it says, yo vivo con VIH. Y today is a very important day because National HIV Testing Day is a moment that when we see all the information around everything that we're doing in social media, all the posts, everybody, the personalities, actors, people that is in the media, people that is in the science field, community field, it's very exciting to see how everybody is joining the efforts and that the work that we're doing disseminating the message is getting to our community. So I'm very excited. Thank you so much for this, and let's continue to share more information.
Thank you so much for that introduction. So I just want to start us off, I want to ask you both to level up and check my HIV status. How can I go about being tested for HIV?
Go for it.
Me? Okay. Well, there's a lot of ways to be tested. Probably the easiest way is going to be the CDC's Take Me Home Together program, which is an online resource. So you can go, and we'll put this up, on our platforms, but takemehome.org is a place where any person living in the United States can go and get a free at-home HIV test. So completely no cost to you. It gets mailed to your house or wherever you want it to be mailed. And it is just a self-test that you do at home with a cheek swab. It could not be easier. And it also is going to link you to resources, whether that test be positive or negative. So that's going to be probably the easiest and free way to go about it, but that's not the only way. You can be tested at your primary care provider if you have one. You can be tested at your local health department, local sexual health clinics. And there's also typically, especially on days like today, mobile stations. So people will be out in vans and buses, and a lot of Walgreens locations today are offering testing. So there's many, many, many different options. Did I forget any, Jose?
We also have the CDC website. You can go, I'm going to put it down. We have the cdc.gov slash together, or en español sería cdc.gov slash juntos. And with these, we can find a amazing locator that is going to help you put down your zip code, and you're going to identify which is the clinic or the testing site that is closer to your home. And you can see also if you have testing services, prep services, HIV treatment, Ryan White services, and many, many information that is very, very useful for everybody.
Thank you so much. And I know it's very important, especially in the Hispanic community, to think about community-based approaches and sort of like a segue to destigmatizing the conversation of HIV. So just to give a little rundown, community-based approaches to HIV care and prevention are of paramount importance in our communities, particularly within the underrepresented communities due to their ability to address multifaceted challenges unique to these populations. So in such communities, cultural, socioeconomic, and structural barriers often prevent access to traditional healthcare services, exacerbating the HIV-related disparities. With that in mind, what barriers have you identified for your diverse patient population? And also, what are some ways you are actively working towards dismantling these barriers as a healthcare professional?
Do you want to start?
Jose?
We are working, and I'm very, very proud that we, as a nonprofit organization, a nonprofit clinic here in the Central Florida area, we're making sure that we address the community with the barriers they're having. So Spanish speaking professionals is very important. So we have healthcare providers that speak Spanish. We have healthcare providers of trans experience. We have healthcare providers that are a Hispanic woman themselves that can have a conversation on a peer-to-peer level. And this is going to enhance the confidence, and it's going to help clarify any questions or concerns people may be having. Having information in Spanish is helping a lot because we know there's a lot of Latinx communities. However, not everybody that identify as Latinx speaks Spanish. Some of them even speak Portuguese. So we have to make sure that we address those language barriers first, and then we can communicate the message. When we also go and interact with our community, just as Aisha and I love doing, we go to the community. We are not just sitting behind the desk waiting for people to come to us. As some of you may know, I go to other countries, I go to other states, I go to support groups, and I am visible because this is the way to reach the people that is really not knowing who can I speak to about my HIV status, or about me being at risk, or thinking that I may be exposed, or maybe I want to do PrEP, but I'm a Hispanic immigrant. I don't have health insurance. My immigration status is not adjusted. So case management, for example, at our practice is vital because we're going to educate the person. We're going to share with them the resources, and then they're going to find out more information, and they're going to say, well, you know what? I feel like this is going to work for me, and then I can start with you guys, and this is going to help me because I'm also diabetic, and then I can also be on PrEP, so that means that I can do my primary care and my sexual health care at one place, all better together, so that's amazing. So yes. So that's how we do it here. So.
Yes, I could not agree more. I echo everything that Jose had to say. And it's kind of, a lot of people have the message, but it's about knowing when you are or are not the right person to deliver that message. As a healthcare provider, I see it all the time that there's a lot of distrust in the medical community, especially when you are treating folks who are socioeconomically disenfranchised, who may be a minority, a racial minority, or someone of trans experience, or just any of these many intersecting identities that can make it more difficult to access services or make you less likely to feel comfortable when accessing those services. So I loved what Jose said about kind of keeping it all under one roof is, HIV care and HIV treatment is primary care. It's not something separate that has to be handled by, an infectious disease specialist at a university, right? Your local provider, someone that you relate to, that you trust, can and should be able to provide these services. And so, being out in the communities, reaching people where they are in non-traditional settings. So sometimes that may be the nightclub, sometimes that may be, a school, a college campus, a church even. That's the way I think to really bring people into care. People like Jose who are out doing the work, being visible, folks on PrEP, folks in the media. Just, I think one of the biggest ways to reduce stigma and increase our visibility and presence in a community is just being there. Having people on social media, having people on TV saying, yes, I'm living with HIV, I'm on PrEP, I get tested for STIs regularly. I think that's really going to be the key to bringing down stigma, especially in communities where this particular condition still is, in the year 2024, very highly stigmatized and highly misunderstood.
Thank you so much. And I applaud the work that you both do because I know that when it comes to community-based interventions, I feel like we don't speak of them enough. And in a way, they sort of enhance the relevance and acceptability of HIV prevention and those treatment initiatives, empowering those individuals to take ownership of their health outcomes. So thank you. One other question, so community-based approaches do play a pivotal role, as we've spoken, in mitigating a stigma surrounding HIV within underrepresented communities. Stigmatization not only happens in HIV testing and treating uptake, but also perpetuates discrimination and social isolation among affected individuals. In the question, what community-driven initiatives can help combat that stigma, that societal stigma, on top of what individuals may experience in the healthcare system?
Go for it.
Great question. Yes, I think, again, community-based approaches are probably even more effective than what we do inside of the clinics. And so I would say, getting into those non-traditional spaces, working with non-traditional partners, which is something the CDC aims to do. One example that comes to mind is the CDC's relationship with a WNBA team, for example. When we were in Atlanta, we had the chance to hear from the Atlanta Dream and other sports organizations. So I think one thing that we can do, like I said, is to partner with non-traditional entities. So whether that's a college campus, a church, the WNBA, like, athletes, media, social media influencers, people want to see that people that they look up to talk about this, which I think is really important and really effective in reducing stigma. If people can see like, oh, this is not some scary thing to talk about. This is something that people live with every day, talk about every day. I think that helps break down the barriers. I think one thing that really drives stigma is the fact that people just don't want to talk about these things. They don't really have these conversations amongst their peers. And sometimes when they do seek healthcare, that alone is also traumatizing and forces people away from the system. A lot of times people feel judged, discriminated against. They don't feel comfortable disclosing their sexual histories to providers. And that's something that we in the medical field have to work on. That is not on the patient's end. And so I think, yeah, to kind of wrap that up, I think to reduce stigma in our communities, it's going to have to start with those non-traditional partnerships, talking about HIV testing and prevention outside of the world of healthcare, bringing it into our regular everyday activities. And then also educating and training healthcare providers from the moment they walk in the door, the nurses, the receptionists, the people, the intake forms, even. We have to make sure that you're not turning the patient away at any step along the process. And so that's something I think that is going to be on our part as medical providers, which will really help to reduce stigma, because in the community is great. The community is where we get people, where we engage with them, find them, and then bring them into care. So we have to make sure that once they're brought in, it's a good, positive, and affirming experience.
Yeah, definitely, Asia. And I know that these approaches, some of which you mentioned, I think it's very helpful for the audience to know how these approaches not only improve health outcomes, but also foster that resilience and solidarity with underrepresented communities affected by HIV. So thank you. And Jose?
I think that we are doing something that is amazing, which is engaging communities by being part of the community. A lot of people just have misbeliefs. Sometimes it's just, I think that healthcare is expensive. I feel like I cannot go to see amazing providers like Asia because I don't have health insurance, or I cannot do PrEP because that I called the pharmacy and they told me that it is, I don't know, $2,000. That's too expensive. So sometimes it's just not knowing that there's resources in the community, and that is why doing what we're doing here, you see, we have a California healthcare provider, we have a Florida practice here in Orlando, and then we have a national association. We're disseminating the message and we're letting the people know, hey, there is resources that we have all this program put together for our communities, because the program is called Ending the HIV Epidemic. And in order to end the HIV epidemic, there's resources like transportation, making sure that you get to your doctor's office with an Uber, making sure that you get your medication delivered at home at no cost, making sure that if you don't want to deliver at home because of confidentiality, you go pick it up. And we have different options. You have insurance, you can get it at no cost. You don't have insurance, you can get it at no cost. You don't have immigration status, you can get it at no cost. So we're making sure that we're addressing the barriers, and we are looking at what is happening in the country, because we need to address if we have a report from a patient or from someone that is saying, oh, I went to this other place and they were charging me $300. Good to know, because maybe other providers are not aware of all the programs that the government has put together in order to address the epidemic. We are going to the gay bars, just as Aisha just mentioned. This weekend on Saturday, we're going to the gay campground at Sawmill here in Florida, and we're gonna be having a big pool party, and we're gonna be celebrating with community, and we're gonna be disseminating the message. They're gonna go there, they're gonna have fun, they're gonna be at a pool party, having a good time, and they're gonna be having access to the resources. What is PrEP, HIV treatment? Where can I get it? Where can I get tested? So we're promoting everything, but not just from, like I say, behind the desk. We're going to the communities, and something that I love from Asia's statement is we're going even to churches. Leadership is in all places, and your priest or the person that is your leader at church, that person have the power to disseminate the message as well. And that's what we're also trying to make sure that we put together events for August, because we need to make sure that all the faith leaders are coming around the table and they're going to disseminate the message to the communities. So letting the communities lead and making sure that we are taking the message to them in community, being community. I am a person living with HIV. When I am talking about it, you have no idea how many messages I get in my inbox, because people is seeing themselves in what I'm saying. They're feeling identified from my testimony. So
Right.
just let it be visible. Let people understand. Aisha just said it. It's part of primary care. It's no longer something that is out of this world that you need a special department at a university. No, you can go get treated by your primary care provider and you can enjoy a healthy life I wish that I had to tell you, you know what, I'm a person living with HIV. I have this pain. I have this itching. No, the symptom, the sign is not physical, it's more emotional, and it is in the
Hmm.
community, which is the stigma. What hurts me is you stigmatizing me, you discriminating me. That is what hurts, but it's not the HIV. And why is it happening? Because other people does not have the information. And today, in National HIV Testing Day, we need to remember, I, at some point, also did believe that I was at no risk of contracting HIV. But
Yeah.
today, we have so many options that the only way to take the next step forward is getting tested. If you want to prevent it, you need to get tested. That's the way to start PrEP. It's actually a requirement by CDC. The first step that we need, a diagnostic test. Do you have it or don't you have it? And if I have HIV, I can start treatment right away and I can get to the goal of undetectable and continue to enjoy a healthy life. So, there's a lot, but addressing stigma and discrimination is right now the main goal and it's important.
Thank you. And that goes into some of the things about what is currently out there. I know that from this conversation, we can agree that by fostering these environments of acceptance and support, these community-based approaches create a safe space for individuals to feel comfortable accessing these HIV services and disclosing their status without the fear of judgment or discrimination. And I want to touch a little bit on some of the things that are currently out there. So, for this piece, in what ways can the current technology that is out there, just from your knowledge, from your workplace, um, what ways can this technology be utilized to enhance the effectiveness of HIV care and prevention interventions?
Yeah, I love this question. So we did touch briefly on a few. One would be, going online and ordering your at-home kit, or going online to the locator that Jose mentioned. But one thing that I always urge people all across the country, all across the world, really, to do is, if you are, say, like I see someone in the comments say that in Florida, people feel like the strong red politics of the state are preventing them from accessing care. If you don't like the providers in your community and where you are, if they are not competent, if they don't make you feel good, if you feel judged or discriminated, you do not have to settle for that. You can go online and make a virtual visit with with a provider anywhere pretty much in the United States. Like, for example, our clinic, we take telehealth patients from all over the place. You do not have to settle for some provider in your local town who's going to make you feel bad. No, 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 no. Go online, set up a telehealth appointment. We can order your labs, we can order your medications, and that way you don't even have to leave the comfort of your own home. You don't have to worry about your privacy. So that is what I think the biggest way that technology has changed the game on this, campaign to end the epidemic, is that it's opened up the doors to practices all over the place. I'm from Alabama. I'm from a really rural community in Alabama, and I'm thinking about what, if I was still living there, what would I do to kind of access these services? And the truth is that you would have to go online. And I know there's so many people in the United States who don't live near a local LGBT center, who don't live near a university that offers safe zone, trained providers. And so technology is huge. You can go online, you can get a test online, you can access a provider online. A lot of times it's either very low cost or free, depending on what services that you use. So that is my one takeaway from this whole message. If you don't hear anything else, hear me when I say, do not settle for healthcare providers who don't see you and don't make you feel good about yourself. Go online, come see me, come see Jose. We'll take care of you.
Yes,
Yeah,
we
no, that
will.
brings up a good point, because one thing to also realize is that when it comes to rural communities, it is very hard to access either a primary care provider or just a particular medical advisor. So the telehealth, it has increased since COVID, and I think it's something that will continue to be utilized in different fields. So thank you.
Definitely.
And Jose?
Yeah, no, I definitely agree with everything. And we recently had experience, and I always have the experience because a lot of people send me messages that they're in need of treatment. And sometimes, as an ambassador, ethically, you just call the clinic, link the patient to other providers, but then they don't have any success in finding an appointment, and they just run out of medication, or they're about to run out of medication, or they're having this anxiety. So definitely, these changed everything when we were able to do the telehealth, and then we're able to see a patient that now feels more comfortable in seeing a provider that is in Orlando and he's living in North Carolina, and even making a trip to Orlando and get to know the practice. And then this is like a success history, like, oh my God, he feels that safe, that confident, that pleased at this practice, that he is coming to us from a different state just because of the services and how comfortable you feel. Like you can discuss about your sexual health, you can discuss about your HIV status, you can get your treatment right away delivered at home. You can go to the closest lab around the corner and complete your lab work. So all those things are going to be more flexible. And again, is addressing barriers. So if you feel like transportation is one of them, or you don't feel comfortable with the person that is your healthcare provider, you don't have to settle for that. You have the freedom and the rights to choose your medical provider. So no matter what, no matter where, you got to be comfortable, because if you're comfortable with the person you are addressing your healthcare, you're going to be successful in the outcome too. So
Yeah.
Thank you. And I know you both play a pivotal role as educators, even through the community ambassador program. So I want to ask what role, and this might feel like a no-brainer, but what role do educators play in addressing stigma and misinformation surrounding HIV within these impacted communities?
education is everything. Is where everything starts. When you talk to someone, and it's so, even on social media apps like Scruff, and everybody that knows me, they always want to ask, hey, I want to ask you something. I had sex with this guy that told me that it's undetectable. I'm on prep. I wanted to know, is there any risk that something happens to me after this? Let's go for education. Let's discuss what is PrEP for and what is HIV treatment, what is undetectable means. So when you are educating, sometimes you are just destigmatizing, you're breaking the barriers, and you are changing the world for a lot of people. I was recently in the news, and I can share that the people that was interacting with me, they were like, after I was talking about PrEP, injectable treatment, that you're no longer taking 30 pills a day, you can be just taking one pill a day, or I do an injectable treatment every other month. I get my injections. Is that for real? So that is education. You're educating this person, and you're doing like the iPhone updates, because you're doing, hey, let's come to 2024. This is what we have
Yes.
nowadays, and this is what we have available, and that is amazing. So educating is fascinating, because you see how people change their face, they change their perspective. And then later on, we had a women event back in March for women month, and then one of these ladies got all this information. She was impressed by all the technology and the updates that we have. And she was like, my brother has been out of medication for 5 months, and he's HIV positive. They didn't have the education, and they were here in town. So educating and sharing this information with everyone, you have no idea what is the borders that this can cross when you are definitely having the conversation. So education is something that I really love.
Yeah.
Before jumping to Asia, I did see a question in the chat. So there was someone was wondering about the current reactions that are about the recent CDC data showing uneven HIV progress among Latino gay men. Do any of you want to touch a little bit on that guidance?
Yeah, just very briefly, my reaction as a healthcare provider is that I think it's, very disappointing. All of the resources are there, and I think that shows more than ever the importance of reaching the people who need this information the most and bringing them in and having incredible people like Jose who are, Spanish speaking and who can be a kind of example of what it means to live with HIV in the modern world. I think we know for a fact that Hispanic and Latino and African American and just, these racial minorities are not being offered services in the same way that white cisgender gay men are. There's a lot of statistics showing that the vast majority of PrEP users in the United States are white cis gay men in metropolitan regions like LA and San Francisco. And so I think my reaction again as a healthcare provider is that I'm disappointed. I'm disappointed in our healthcare community. I'm disappointed in our efforts to reach people who need it the most. Um, and I think it really just shines a light on how much work there still is to be done and why these sorts of events like we're having today, with this organization and with Jose and all the incredible work that he's doing is so important. But I'll defer to him as, someone who's in the community and living that experience.
Wow. A gay Latino person living with HIV. Yes, this is happening. Listen, we are talking about HIV, and you have no idea how big the concern about syphilis is. We are even at a moment where we're like, okay, what are we gonna do? There's not enough bicillin in the country
Yeah.
because it is happening. And when we talk and people that is advocating for our communities, just like me, when I'm talking and I'm saying we need to address the community, we got to meet them where they're at. I am saying it as a fact, as something that is really happening. We need to make sure that we understand what the numbers are saying. And when the numbers and the data is talking to us, we need to interpret it and address it. I have always, and Isha knows that sometimes there are some warm conversations. I am saying and advocating, we need to make sure that we put the information in Spanish. We need to make sure that we go to the communities. We need to make sure that other people getting funding is also accountable and is doing the work. So when we see this, I can only comment from this statement that we had in the questions is that it's not a surprise for me. I know that we are having a very high community, like is a high number of people that identify as Latino. Just like I say, it's not only Hispanics, but there's also people that is from Brazil. There's a lot of immigrants, people from Cuba, Honduras, Ecuador, Venezuela, every single Hispanic country. And when we're talking about the numbers that we're having in the United States, what is happening? Are we having the access to the resources? Do they know? Just like this case I just mentioned, 5 months out of treatment. They didn't know that there were services here in the town that they were at. So, and then you say, what are we doing? What is it that is missing? How can we reach these people? And there's a lot of information in the internet. You go on YouTube, there's a lot of information, yes, but you got to go to the communities. I feel like we got to go more to the communities and we have to make sure that we also address the cultural barriers. It's not only the
Yes.
availability of resources, but if I'm coming from Venezuela, first of all, I don't know what PrEP is because it doesn't exist in my country.
Mm.
Second of all, going to the doctor has some cultural beliefs, where should I go? And being gay, wait a minute. I am DL because, not everybody can know my business because, I'm going to disappoint my mom because they cannot know that I'm gay. We're not even getting to the topic of sexual health. It's just identity. Being a person of trans experience, let's not even talk about sexual health. Just the identity part is a heavy topic. So there's too many things that we are still trying to address and go through. And with these numbers, I feel like we just got to continue to put the information out there in Spanish, doing and continue to do the amazing work that people like Mono Trepao, Raul Marca, Aisha Sullivan, all the Black African American community is also having amazing leadership. We're having amazing trans leaders in the Black African American community. We are having people that is really doing the job. We just need to keep it up and we need to ensure funding and we need to ensure that we do not bend the knee. We need to continue the work because the cure is around the corner. But it can only happen if we continue to work together as a community, strong as a community, and we continue focus on the main goal.
Yes, this conversation reminds me a little bit of something I was reading in terms of language justice too, and
Mm.
just as you had touched upon, Jose, it goes into some of those cultural barriers because we're not even talking about the testing yet. We're still talking about the stigmatization, and that's something that we have to have more education on, especially for those that are coming in. And then they don't know anything about what these resources actually mean. So, and just to finalize the one last question, so what would you say are some long-term benefits of investing in community-based approaches to improve HIV care coordination? Now, this example from someone that mentioned in the comment about the current data kind of like starts to make us wonder, okay, so let's talk about the long-term benefits.
Yeah. I mean, again, when you're talking about coming into a healthcare provider's office or like non-community based approaches to treatment, that is literally a moment in time. That's an hour of your day, 3 to 4 times a year, maybe, if even. So, investing in these community approaches where people are living their lives every day, where they're socializing, living, working, raising families, that is where the real change takes place, especially as it relates to stigma. Because again, being in the office is an hour of your time. We have whatever conversation we're going to have, but what happens when you go home and you talk about your experiences with your friends and your family? That's where we see these long-term changes. And so, we're in America and money talks, and there's truly, unfortunately, there's no way to get work done to make this sort of progress without financial investment. Like, yes, you can have people who are willing to do the work. Yes, you can have people show up. But if we don't pour money and funds into these programs, we're not going to see the long-term outcomes that we need, and they're also not going to be sustainable. So my vision, I guess, for these community outreach programs, wherever they may take place, is that they become self-sustaining, that they know these communities no longer need our ambassadors and our healthcare workers to come in and talk to them. They already know what's there. They know the resources themselves and can start to talk about it and disseminate the information amongst each other. They don't need us anymore. And I think that goes back to your previous question about educators. And I think when we think of educators, we think of teachers and professors and doctors and case managers, but really an educator is anybody. And the most effective educators are your friends, your peers, your family. I think that a lot of times, we see the portrayal in the media, like what we see in the movies and this and that is sort of the HIV of the past. Like we see, the history and the suffering and the struggle, but we rarely see the triumph because like Jose was saying, it's not exciting anymore. You take your pill, you take your shot, and you live on about your day. You don't have to suffer. You're not having, you're not dealing with these medical complications. I'm treating people living with HIV who are 90 years old, who Sarah converted in 1985, and they're living their best lives. So it's just really a matter of pouring into these communities, being visible, like people like Jose, people on social media who are willing to say, hey, I'm living with HIV, or I'm on PrEP, or I'm being tested, or this and that, and just talking about it to each other. But yeah, I mean, again, the benefit of community investment and community engagement could not be overstated. And so we have to essentially pour into these communities until they're able to do the work for themselves. It's self-sustaining. Everybody knows where to go for care. Nobody is gonna blink an eye if you say, hey, when was your last HIV test? Or, hey, I'm just leaving my doctor. I had my HIV labs done. That I think is where the real change takes place. And I think, we clearly have a lot of work to do as evidenced by that data in the comments, but, we're inching slowly there. And so I'm really optimistic about the future of the campaign and of HIV treatment and prevention.
Thank you, Asia. And I think it means a lot with the work that you do as well, because it's seeing providers like you that make it easier to seek out those preventative measures. So thank you.
Thank you.
And Jose?
Thank you. No, I definitely now you all can see and understand why I love Asia, not only as a friend but also as a fellow ambassador and advocate, because that's what we need. We when we go to school, we cannot forget that we're human beings, and when we're working in healthcare, we're working with human lives. So we need to make sure that we humanize the treatment, we humanize the conversation, and that's what happened with people living with HIV, with people on PrEP, with people of any diagnosis, because we cannot be defined by the diagnosis. So today the message is for everyone to join the efforts. You can do it just as Aisha said. You can be an educator. You don't have to say if you're on treatment. You don't have to say if you're on PrEP. You can only talk about the fact that you can be in prevention uh, methods. You can be on treatment. Undetectable is equals untransmittable. You can talk about so much information. You can be a mother. If you're living with HIV and your baby is not going to be HIV positive if you
Yes.
follow your medical
Yes.
provider recommendations. You can do so many things that are amazing, but we need you. We need our community. And for my Hispanic community, I thank you, because with everything we're doing and all the support we get, we can continue to see the reason why we do a cena is because we Latinos, we Hispanic people love gathering around food. So we just go and have a party, and then we have some food and all together. And then right there you get the people with the information and the resources. And now, because of we are seeing these numbers, we can go ahead and address it, and we put everybody um, to address what is happening. And I'm pretty confident that with the leadership that we're having, especially the leadership that we're having at the White House right now with Hispanic representation at the Office of AIDS Policy,
Yeah.
I feel so represented, so happy, and so proud that I'm pretty sure we're going to be making real impacting progress very soon. So thank you so much for everything you're doing. I hope you all enjoy all your activities. I know that we're having several activities for National HIV Testing Day, and even at the practice. I know that some people has been in and out here because we're at the Pineapple Healthcare Studios here, and we're doing a lot for the community. We're doing HIV testing. We're doing the Walgreens events. We're going to other events that happen every single day. And thank you to the leadership for every single organization and initiative, and for you to bring us here and have the conversation and connect with other people that can follow us on Instagram. They can send us direct messages, and of course, we're gonna
Yep.
link them to any of our fellow ambassadors. If you're at a different state, you want something more local, we have a very wide network that we can link you to. So I'm really grateful for that. So thank you so much.
Yeah, and I want to take a moment to highlight your beautiful interview with Univision, I believe, right? Yes,
Yeah.
because I think that people don't realize that when it comes to the Hispanic community, like just having those media channels, just having that conversation through those media channels really does have a powerful impact. I know my parents, in just having those stories, kind of like, being seen on TV, they're able to learn a little bit more, and they're also able to inform themselves, and just my family inform themselves of why National HIV Testing Day is so important. So thank you so much. Definitely, everyone, please check it out. And with that, I want to conclude our Instagram Live. Please be on the lookout through our NHMA MD channels, media channels, of a recording of this Instagram Live, so that way you have access to all these resources and just bringing up the conversation with family members, friends. I think that this is crucial to, doing our part and becoming those educators, because as Asia said, it's not just about professors leaning on to professors or medical professionals, but it's also doing our part and informing ourselves of what resources are out there to support the people that we care so much about. And yeah, that concludes it. And we'll be, sending this information forward. Be on the lookout on our Instagram story for some of the materials pertaining to the Let's Stop HIV Together campaign. But also just know that through NHMA, if you are a representative of an organization, you can visit our website under the HIV tab, and also we offer free free shipping of resources. So definitely check it out. So that way you can have it for either your practice, your organization, whatever you think will help everyone educate themselves about the stigma, but also the testing services, the Together Take Me Home campaign, and all these things, very important. But also, if you are a provider yourself out there watching us, just remember that you can join NHMA as well, and then also be a part of the work that we do here with the Let's Stop HIV Together campaign. So I just want to offer that as some resources, and I want to thank you both, Asia and Jose, for your time.
Thank you so
It
much.
was
You
a
have
great
a great
conversation.
day.